Good morning, everyone. Thank you for virtually joining us for this exciting announcement. I'm very pleased to be here today for today's announcement, and thank you, Premier Horgan and Minister Dix, for inviting me. I would like to introduce our speakers today, BC Premier John Horgan, Dr. Richard Chen, Medical Director, and Chen, Clinical Coordinator. I would also like to acknowledge my colleague here today, MLA Aman Singh. Primary care is one of the most important services provided by government, and we know there is more we need to do to deliver the healthcare people count on. We all know how stressful it can be when we or someone close to us need fast and quality healthcare. In Vancouver, we know it can be difficult to get the rapid, quality, and efficient healthcare services that residents need and deserve. About 56,500 people in Richmond reported not having a family doctor, and those who often do struggle to find the same-day access to primary care. A lack of access to a primary care provider does not just affect the people in the region, it also affects 17.7% British Columbians who report not having a primary care provider. That's why we announced to BC Primary Care strategy to transform our healthcare system. Through this new approach, we are working to make sure people have faster and better access to the day-to-day healthcare services they need by investing in team-based primary care. This is why today's announcement is such a great news. Today, we are announcing a new Urgent Primary Care Center, or UPCC, is opening soon in Richmond. The UPCC will open in two phases. Starting April 1st, 2021, the center will be temporarily located in the Community Health Access Center at 7671 Alderbridge Way, Richmond. It will provide urgent primary care services in evenings and on weekends. In fact, the center will open Monday to Friday from 6 p.m. to 10 p.m., Saturday from 8 a.m. to 10 p.m., and Sunday and statutory holidays from 9 a.m. to 5 p.m. We expect 10 full-time equivalent healthcare workers, including general practitioners, registered nurses, and a social worker will join the UPCC. The team will deliver urgent primary care services to people who need to see a healthcare provider within 24 to 48 hours, but do not require a trip to the emergency department. This includes care for people with sprains, minor cuts, and high fevers. The center is expected to open in its permanent location in November 2021. It will then add full-service long-term primary care services, including mental health, social service, social work, and as well as medical diagnostics. At that time, the center will also work to connect patients with a family doctor to a physician or nurse practitioner, either at a UPCC or in the community. The new UPCC will truly bring a real solution to the thousands of people living in Richmond and the surrounding communities. Today's announcement would not be a success without the dedication and collaboration between the Ministry of Health, Vancouver Coastal Health, and the Richmond Division of Family Practice. Thanks to the Premier John Horgan and Minister Adrian Dix and all the partners for your continued dedication in transforming the way we receive care. Thank you also to the frontline workers who are working hard every day to keep us safe. I'm looking forward to the opening of the UPCC and how it will make life better for people in my community. Thank you. Next, I would like to invite Dr. Richard Chen to share some remarks.
Great, thank you, MLA Yao. And on behalf of Vancouver Coastal Health, I am proud to be here today as we talk about a brand new healthcare service coming to our Richmond community, our very first Urgent and Primary Care Center, or UPCC. The opening of UPCC for Richmond has been a dream for many of us for quite some time. And thanks to the great partnerships in our community with the Richmond Division of Family Practice and other key stakeholders, our dream is becoming a reality. As mentioned, the first phase of our project, which will open on April 1st at the Community Health Access Center on Alderbridge Way, will allow us to open an after-hours urgent care clinic. The clinic will provide Richmond residents with access to same-day care for non-life-threatening illness or injury. Conditions such as cuts and wounds, sprains, fever, minor infections, asthma exacerbations, and even emotionally related issues are just a few examples of the types of cases that can be treated at the clinic. In this interim location, we will have a multidisciplinary team of physicians, nurse practitioners, registered nurses, social worker, and medical office assistants to help patients access urgent services in the evenings, weekends, and holidays. Now, the UPCC will not replace our emergency department for life-threatening conditions, such as heart attacks, strokes, or major trauma. It also will not replace your family doctor or nurse practitioner as the first point of contact for non-emergency care. The Richmond UPCC is expected to expand and open in a permanent location in early 2022, where patients will also have access to long-term primary care services, including mental health and social work. The UPCC will work in concert with all touch points of care and serve as a central access point for medical services for the community, including attachment for those looking for a primary care provider. Now, as a physician, I know how important a service like this is for our community. This past year, we have worked hard to keep people safe during the pandemic, but we also need to ensure that we continue to meet the needs of a growing community like Richmond. With one of the fastest growing seniors population in the entire country, many young families from a variety of cultural backgrounds, Richmond is a vibrant community with unique health needs. Bringing this after-hours urgent care clinic and our future full-service UPCC to our community, we will allow patients to better navigate our healthcare system and receive the right care by the right provider at the right place while relieving pressure off of our acute care services at the hospital. Thank you. It is now my pleasure to introduce Chen, our clinical coordinator at the Richmond UPCC.
Thank you, Richard. I'm happy to be here today and excited about the opening of this new urgent and primary care center. Urgent and primary care centers are becoming an incredibly valuable addition to our healthcare system. The Richmond UPCC will bring more healthcare options into the community, making it easier to access non-life-threatening urgent care within the community. As a nurse, I see the importance of this for patients, staff, and the healthcare system. UPCCs allow patients to receive the right care by the right provider at the right place. We are bringing more healthcare services even closer to our patients, creating a better patient experience and creating more capacity for our emergency departments to treat life-threatening injuries and illnesses. This offers another option for immediate care for those who need urgent treatment. I look forward to seeing the Richmond UPCC operate as a service that is welcoming, safe, and that provides appropriate urgent care to patients. We have a wonderful team who are looking forward to meeting you and understanding your healthcare needs to best support you. Urgent and primary care centers won't replace emergency departments for life-threatening conditions. It won't replace your family doctor or nurse practitioner as your first point of contact for non-emergency care. We do have an interdisciplinary team of healthcare professionals that are here to provide same-day treatment for our patients closer to their home. I hope you are as excited as I am for the Richmond Urgent and Primary Care Center to officially open its doors. On behalf of the Richmond UPCC staff and leadership team, we would like to thank the residents in Richmond for inviting us into your community. I am thrilled to be a part of the opportunity to expand and enhance care for residents in our community. Thank you. It is now my pleasure to introduce Premier John Horgan.
Thank you very much, Jane and Dr. Chen, and of course MLA Henry Yao for introducing and announcing the arrival of our 24th Urgent Primary Care Center in British Columbia, the 5th in the Vancouver Coastal Health Authority. I'm coming to you today from my office at the legislature on the traditional territory of the Lekwungen-speaking people, the Esquimalt and Songhees First Nations. And it is great to hear Dr. Chen and Nurse Chen talk about how excited they are about delivering primary care in Richmond. Over 26% of the population of Richmond does not have access to a family doctor. Our urgent primary care centers and the primary care networks we're building up across British Columbia are taking steps to fill those gaps as we train more healthcare providers, more clinicians, more therapists, more nurses, more nurse practitioners to meet the needs of our aging population and meeting the expectations of the delivery of our public health care, not just in Richmond, not just in Vancouver Coastal, but indeed across the province. The pandemic has made it glaringly obvious to all of us that one of the unique assets we have as Canadians and as British Columbians is a public healthcare system that can be responsive in the midst of a global pandemic, but also needs to be equally responsive to the day-to-day concerns of British Columbians, making sure that we get the right care for the right people at the right time, as Dr. Chen and Jane have said, is fundamental to our vision for healthcare in British Columbia. I want to acknowledge also my colleague Aman Singh, the MLA for Richmond, Queensborough, and also Kelly Greene, the MLA for Richmond, Steveston, who have been working with Henry to make sure that Minister Dix has a full understanding of the challenges in Richmond. And then, of course, working with the Division of Family Practice to make sure that we are meeting the needs of the healthcare providers in the community. It's the coming together of elected representatives, community leaders, and those in the healthcare profession that work every day to keep British Columbians well, that will keep us on the cutting edge of innovation in Canada. I'm very proud of the work that Minister Dix and his team have done to launch the urgent primary care process here in British Columbia, 24 across the province, one in my own community of Langford, that is meeting the needs of thousands and thousands of British Columbians each and every day. These are positive steps forward, but we have much more work to do. The only way we'll meet the needs of all British Columbians is if we have the type of collaboration that we're seeing here on this call today with Dr. Chen and Nurse Chen about how we come together to make sure those services are there for people when they need them. We need to make sure that there's a direct line between people and their healthcare providers, and the UPCCs can do that. This is a temporary start to what will be a permanent process, as Dr. Chen said, and we're very excited about that. I can't wait to continue to deliver on the needs of the people of Richmond. Today is a very positive step in that direction, but we have much more to do.